This is one of my favorite manual therapy techniques when I'm working with folks with low back pain. Now, it's no secret that the pelvis plays a key role in how the low back moves. The pelvis's ability to get into what we call expansion and compression positions will dictate how the hip moves, and in turn, how the low back has freedom to be able to move. So what we want to do is we want to make sure the pelvis is open enough. Now, I kind of exaggerated the motions here. The pelvis isn't going to move this much, but it has enough motion to affect how the hip moves. So the technique is we have the person lie on their side, stacking their legs on top of one another, and we're going to get up on the table, or if you can position the table lower, that's all the better. We're going to find the greater trochanter. The greater trochanter is the bone that sticks out on the side of your hip that sometimes you hit on a table and kind of hurts. And we're going to go superior of that, so just above it and slightly behind. And we're going to get on top of the pelvis here. Now, I want to make sure I'm utilizing my body weight and not just my hands. So I'm going to get my elbows as straight as possible, my shoulders on top of my elbows, so I'm kind of stacked on top. And I'm just going to drop my body weight straight down. Now, we're not expecting a whole ton of movement where I'm going to be pressing here and expecting this whole thing to sink down towards the ground, but we are going to see some movement. And what this is allowing us to do is neurologically giving the pelvis a feeling of movement, so then it learns it, and then when we have the patient go back on their back or check their bending forward or bending backwards, we can actually see some change here. We want to make sure that we're doing a sinking feeling here rather than a pressing feeling. Because if we're pressing, it can get pretty tender because we have to go through some of the glute muscles here. So we want to make sure we give the body time to acclimate by pressing in nice and slowly and sinking down to the bottom rather than just being pokey around here. Now, after you work on this, you can have the person go back on their back, recheck their hip range of motion, and then from there, recheck their low back range of motion, whether it's bending forward or bending backwards, and see what you see.